Us now to discuss what we have been watching is NBC News Capitol Hill correspondent Julie Surkin, Dr. Amish Adalja, senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health, NBC News medical contributor Dr. Vin Gupta, and MSNBC senior enterprise reporter Brandy Zadrozny. Julie, for those who maybe just tuned in at the top of the hour or are just joining us now, talk to us about the highlights from the hearing so far.
Yeah, Anna, well, I think it's important to point out that this is a Republican-led committee that called Susan Menares before them to hear the truth. Over and over again, when I talked to Senator Bill Cassidy, who's the chairman of that panel, I asked him, what do you want to hear? What's the purpose of holding a hearing with somebody that has already been ousted from the position that she held for so brief amount of time? And he said over and over again, it is the truth. And that's certainly something that has been resonating through her own remarks, her opening statement that she said over and over again. She had the title. She had the position that she worked so hard to get, but it meant nothing if she had to compromise her integrity. And that is what she felt like she was doing in her short tenure at the CDC. She shared how Robert F. Kennedy Jr., the HHS secretary, asked her essentially to rubber stamp a whole set of guidelines when it comes to vaccinating our children in particular. She refused to do so without even seeing what the evidence behind that was. There were a couple of exchanges with senators on both sides of the aisle, Republicans and Democrats alike, who seemed to be concerned about the way this is going for RFK at the HHS, the confusing guidance that isn't restoring or doesn't seem to be restoring confidence in the CDC, in the vaccine system. And take a listen specifically to an exchange that she had with Bernie Sanders, who's the top Democrat on that panel, about children. Watch.
What are the long-term implications for the well-being of our kids and the future of our country if faith in vaccine science is undermined?
Preventable diseases will return, and I believe that we will have our children harmed for things that we know they do not need to be harmed by. Polio, measles, diphtheria, whooping cough. I worry about the ramifications for those children in illness and in death. I worry about our school systems. I worry about our medical institutions having to take care of sick kids that could have been prevented by effective and safe vaccines. I worry about the future of trust in public health.
Now, the question is really, will this lead to any change? Will Republicans lose their confidence in how this has been going? Well, not really, because if you listen to other Republicans on that panel, including Roger Marshall, that you came out of there when that committee went to break, he made it very clear that this is all about the COVID vaccine, that people don't have trust because of what the CDC did. Well, apparently Republicans, it's very clear, and Democrats take issue with that.
Okay, Julie Surkin, thank you so much for that recap. Dr. Gupta, several questions about the childhood vaccine schedule. If you're a parent at home, you might be confused of whether you should get your children vaccinated based on the, guidance and guidelines we've had up until this point. How crucial is it for children at specific ages to get specific vaccines?
It's really important, Anna, because we know that it takes a few doses to get full immunity against, say, measles or tetanus, diphtheria. We've been hearing about all these different infectious diseases that, frankly, we haven't really had to worry about all these years. Polio causes respiratory paralysis, full body paralysis, not something we've seen since frankly, at scale since the mid-1980s. We used to see 300,000 cases annually across the world. Now maybe a few hundred. It's back on the rise again. But, what's really chilling here is just hearing the testimony and really understanding how worried Dr. Menares, Dr. Oury are about the new ACIP members. If you look at their backgrounds, these are people that have peddled falsehoods when it comes to treatments for COVID-19. They made their name on that, and now they're being put into these positions. There's now 13 positions on ACIP that are filled. Pretty much everybody to a T has issued some version of a falsehood about COVID-19 treatments or vaccines. So it signals what's likely going to happen tomorrow and Friday, which is why now, you and I were talking about this earlier, hospital systems now are taking it in their own hands. Potentially states will see that soon too, to issue their own guidance. But this was happening as we speak, that hospital systems now across the country are saying, you know what? We're not going to even wait for tomorrow and what happens because we know what's going to happen, and it's likely not going to be something they like.
Yeah, Dr. Adalja, as Dr. Gupta just pointed out, there's this vaccine meeting happening tomorrow, and that's why it was such a big part of the discussion here, because Kennedy gutted the vaccine advisory panel. He replaced them with several people who've expressed vaccine skepticism. And Dr. Menares testified that she had a conversation with Secretary Kennedy in which he told her he had spoken to the president about changing the childhood vaccine schedule, but provided no evidence that would support changes to it. So what do you make of that?
This is exactly what you would expect from RFK Jr. He is an anti-vaccine advocate, someone who sees no value in vaccines, and he was sent there with a mission to dismantle the entire vaccine infrastructure of the United States, and he's been doing it meticulously and successfully. So his ACIP has now been transformed from what really was gold standard science to now an organ of anti-vaccine propaganda. To be on ACIP, you don't have to be good at scientific evidence interpretation. You just have to be somebody that RFK Jr. likes, who's expressed some sort of disinformation about or spread disinformation about a vaccine. That's what it takes to be on ACIP in the current era. And I think it's basically a worthless organization now. And unfortunately, though, it has government power, so we're sort of beholden to them.
Brandy, one name that came up was a guy named Aaron Siri. Dr. Menares testified that Kennedy wanted her to speak with him. What do we know about Siri and his influence inside HHS?
Well, Aaron Siri is not part of HHS. Aaron Siri is a longtime colleague and friend of Kennedy's in the anti-vaccine movement. Aaron Siri works at a law firm that is the biggest recipient of funds from the biggest anti-vaccine organization in the country. Basically, Aaron Siri goes around and goes into cities and states where there are vaccine mandates and chips away at those with legal assaults. He has made millions and millions. It's a very lucrative business. And we also know he got a little bit of bad press because everybody loves the polio vaccine. He got a little bit of bad press when he petitioned the government to revoke the polio vaccine. I mean, this is, I often say that, you know, that RFK is the name behind the anti-vax movement. Aaron Siri is the brains. So why would the CDC director need to meet with an anti-vaccine lawyer? I find it shocking.
Yeah, what is your reaction to knowing that this person apparently is in the orbit of the Health and Human Services Secretary and is part of the broader discussion about how the public should be getting vaccines or not?
Well, you know, I'm worried that we're distracted focusing on things like COVID for children, and here they are talking about polio. You know, Anna, for your viewers out there, this is a devastating illness that required us to have the iron lung and other innovations to save people's lives 50, 60 years ago. We haven't even had to think about it. But the fact that this is even fingertippy and top of mind is chilling, just to reuse that word. And then, you know, the questions from Senators Marshall and Paul, I think, signal what's going to happen over the next 48 hours. They deflect. They're asking almost completely irrelevant questions, talking about COVID transmission. But the whole purpose of these vaccines, especially the COVID vaccine, is to keep you out of the hospital. And I really do think, just to emphasize something Dr. Offit said, the data does exist. We kept coming back hearing, well, Kennedy doesn't believe that there's evidence that's been generated on the effectiveness of all these childhood vaccines. Kept coming back to that. It's not true. The COVID vaccine for kids, actually 6 months to 23 months of age, AAP, American Academy of Pediatrics, Anna, published a seminal article in 2023, looked at children that ended up in the hospital with severe COVID-19 pneumonia. All but 4% of them were unvaccinated. And so there is a clear link between the development of severe pneumonia in a developing child's immune system and being unvaccinated. And the fact that they're just turning a blind eye towards the successes of the Hep B vaccine, 22 million lives saved since it's been instituted, the birth dose back in the 1990s. Polio, we already talked about. COVID-19 and its impact in preventing severe complications in young kids. I mean, they're turning a blind eye towards science that's been gold standard, and they're just pretending it doesn't exist.
And now it seems, Brandy, that a lot of parents are confused. There's already data. NBC News Health and Medical Unit, along with Stanford University, found that since 2019, 77% of American counties have seen a decline now in their childhood vaccination rates. How did we get here?
Well, there's also been some research about vaccine hesitancy, and there's this thing that happens with parents where it sometimes can feel like not doing anything is just the safest route. So when there's so much confusion, when you have the CDC saying one thing and you have Kennedy saying another, and you have all of these, excuse me, right-wing influencers saying another, it can be very, very hard. And so it's a natural sort of inclination to just say, you know what, I'm just going to wait. The problem with that, of course, is that diseases don't wait, right? Diseases are spreading, whether you like to acknowledge that or not. And what we've seen with measles outbreaks and all the rest, like these are coming for you. And so waiting is just a really dangerous enterprise.